Educators across the country are struggling with the uncertainty of how to reopen safely. Most college campuses shuttered in mid-March as COVID-19 spread around the world. Now officials at universities of various sizes and locations across the country are grappling with how to reopen campuses and hold classes in the fall. This week, some schools began announcing their plans for the next academic year. Creighton University in Omaha, Nebraska was a trailblazer in doing so, one of the first to announce when and how they'll reopen. Creighton's president Daniel Hendrickson joins us now with more about that. Father Hendrickson, thanks so much for being here.
Lindsay, thanks for the invitation. Glad to join you.
So you announced in a letter yesterday that Creighton is adjusting the academic calendar to hopefully reopen safely. Tell us more about what that modified schedule looks like.
Well, what it does is it maintains the academic hours that we need for course completion for the entire semester. It compresses it just a bit. It lets us begin our academic season just a little bit earlier and of course to end earlier. And I think that'll achieve two things for us. One is that this gets us a bit ahead of the cold and flu season, Lindsay, that we know will come in, into our lives anyway. And that's going to be confusing as we've all negotiated concerns around this terrible pandemic and if people are sick or what it means. We know we'll have colds and flus in late November and early December. And so getting ahead of that and off campus and done with the semester seems very attractive. And then secondly, in doing this, by opening early and ending early, we're eliminating 2 full travel cycles in and out of campus. And we have kids from 52 nations around the world and most states in the U.S. And so all of those kids would go home for fall break. They'd all go home for Thanksgiving, or, a lot of them, the majority of them, and then be returning to the university from various geographical locales. So we're eliminating those 2 travel cycles. So we can complete a full semester, get the intensified learning to happen, get the kids in the classrooms and get them out.
So you say that students won't return to campus after Thanksgiving break to avoid spreading a second wave of the virus in late November and December. But flu season can begin as soon and as early as October. And we don't know yet exactly what COVID-19 seasonality is like. So what would you do if we start to see a possible second spike earlier than what you're planning for?
Well, we'll certainly continue to maintain a lot of the policies and protocols we're seeing. We're looking at a lot of data and science along the way. We're a community full of all the healthcare programs in medicine, dentistry, therapies, nursing. So we've got a lot of experts on the ground. We have our own epidemiologist. We've got a healthcare enterprise, CHI Health. So we're in conversations with a lot of those experts looking at data and science. Some of the on-the-ground things that we'll be implementing would be daily online screening, and we can ask students to log their temperatures, to indicate if they're coughing or if they have symptoms. We have other things that we can do around thermotechnology and temperature checks. We have face coverings that we'll be asking students to wear. Social distancing, of course, which is so many of us are already practicing to begin with. So a lot of these safety protocols that we'll be implementing for the return of our students.
Curious to know why you decided that you would for sure be back open for classes in the fall. As you know, some other schools have decided that it's just not in the cards.
At least for right now, and so we learned that in March, when we went online and did that rather quickly, we did it very effectively, and it just worked so well. We have a lot of students, faculty, and staff who do want to be back on our campus, in the classrooms, in-person instruction. We provide that intensive environment here on this campus to begin with research programs and clinical opportunities. So people are really looking for that on-campus engagement, which we want to provide to them. I think starting early and preventing, getting ahead of the flu season is going to be helpful. And we know that if we have to rotate on a dime and go remote, we will. We've done it once before. We can do it again. We can do it even more effectively.
And lastly, do you think that you've been given enough guidelines from the government as far as how to keep your school safe?
We look at guidelines from multiple sources, from the government, locally and nationally. We've got key websites that we're looking at for expertise, for science, and for data. So lots of different sources of information, including our own professionals on this campus.
Father Hendrickson, thank you so much for your time. We appreciate it.
Thanks, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.